West Marion Incorporated is the first and only Black-led nonprofit in McDowell County, and we make shift happen. We started back in 2016. It was an initiative with KB Reynolds Healthy Places, North Carolina, and the McDowell County Health Coalition had built environment pods, which was groups that went out and tried to talk to the community and see about what they wanted. So the first suggestion, they said, well, how about going to West Marion? And they were like, well, those people over there don't want nothing different. But Mary Snow, the consultant at the time, said, well, let's just give it a try. So from that process, she met with local leaders, and the whole process was inviting people in to have a conversation. So the first official forum started in April of 2016.
When the group formed, it formed under the name West Marion Community Forum Incorporated, and I did their legal paperwork for them to do that because I believed in what they were doing, trying to bring cohesion, compassion, awareness, education, not only to the African American community, but to the entire McDowell County community. That was one of the things I liked the most, was the organizational objectives of this group to enhance the lives and health of everybody.
So the focus of today's Racial Equity Collaborative meeting is, we have two actually. One of our ongoing overall arching goals is declaring racism a public health crisis. So we wanted to debrief about Hurricane Helene because that disaster has come through.
Now, the latest on the aftermath of Hurricane Helene and the desperate search for people still missing. The death toll climbing to at least 166 people across the Southeast.
But we begin tonight with the spiraling emergency after Hurricane Helene, the mounting death toll, at least 182 lives lost, hundreds still unaccounted for.
My first interaction with West Marion and the community forums was on a more personal level. I was really able to see what was happening at the grassroots level to let community members be completely engaged in addressing the issues in their community and coming up with their own solutions. The beauty of the relationship that we've had with the community forums over the years is that they've also embedded in our emergency preparedness sector. So we meet quarterly and we say, you know, we prepare on sunny days for the rainy days. And so they're well informed, they're embedded in our local emergency planning committees. They come do drills with us. And so they're able to embed with us immediately in disasters. And so when this disaster took place in late September, Ginger, Donna, and Paula were some of my first calls because I knew that they've already been embedded with us. They can be in our emergency operations center to assist us, but also to really give us a lens into these communities that may be isolated or underserved to help us understand what needs to happen there to support them. And they've continued throughout. They helped with answering phones in our call center. They volunteered with logistics to deliver commodities. And since then, they've really been a really great partner in helping us understand some of these communities and how we can better assist them. Because a lot of communities aren't necessarily going to approach us for the assistance that's available. We have to be proactive and do outreach.
The strategy that we implemented for our health equity town halls were 4. So the very first one was the fishbowl, where we had providers and community come together and sit at the table and really discuss some hard questions about the healthcare system, its strengths, its challenges. And then from there, one of the largest things that came out of it was the language justice piece, where we decided to have our sign-in table completely in a different language, in Spanish. And so people that were coming in had to figure out how to sign in, and there was no interpretation similar to what somebody would experience in a healthcare system, whether it was a hospital or clinic. And then that took us to the third one, where We wanted to see the challenges that providers face in the day-to-day life in the healthcare system, because we know that they also struggle with some of the challenges. So we were able to get 4 to 5 providers to come in, and we had a panel and people were able to ask questions as well and learn a little bit about what it's like to work in the healthcare system. One of the largest things we have going on right now is our health equity toolkit. And so we've partnered with UNC Blue Ridge, one of 2 doctors there, to implement a toolkit that is bilingual and can be used in Spanish and English for the patients.
I've had several experiences with West Marion, but the most memorable and certainly the most impactful for me have been the forums that we held on healthcare and how it has impacted some of the different communities and the perception of healthcare in some of the different communities. We had at least 3 meetings about that, where there was good interaction with members from the community who have had experiences with the healthcare system, not only with the one I work in, but also other ones in the community. And it was very helpful to hear the perception and the perspectives of those who had had interactions, what the good things were about those interactions, but also the negative things, the things that were not perceived perhaps as we thought they would. We're a lot more aware of the problems that are encountered, I think, than what we were previously prior to that feedback. We're certainly much more aware of the history that dates back long before any interaction I'd ever had with anyone, but being aware of events that happened 70, 80 years ago in other parts of the country that still have lasting impact, lasting impressions that affect the way that people interact with the healthcare system. Health equity to me means equal access, that everybody has access to care, that everybody has the opportunity to expect the same excellent outcome that anyone has, regardless of race, gender, anything, that everybody has access to that.